Hello, my name is Ryan Chesterman, Service Experience and Wellness Coach for North American Partners in Anesthesia. All this week, Patient Recognition Week, I'm continuing to share some best practices and tips to enhance the patient experience. In anesthesia, when I work with clinicians, the biggest problem is that we have limited time with our patients. And sometimes, really most of the time, we don't know our patients. We know the records that we read, but then when we go in and meet with that patient, we have very, very limited time to connect with that patient. So I'm coaching a lot on building up that introduction and allowing the clinician to connect with that patient in that short amount of time that they do have. If we look at other specialties, within primary care or other situations where patients are coming in and meeting with clinicians, we're time bound in healthcare. So how do we overcome that time bound area and allow patients to really understand that we're spending more time with them? So that's today's tip, is really looking at how do we create a feeling of more time spent with patients. So my advice is to have an internal agenda of how you want to move through that conversation and what you want to learn from that patient, but then also allow that patient to speak. The problem that I see a lot of times is that clinicians, their internal agenda overpowers that, and they want to get through each of the topics, and then the time runs out and the patient feels as though that you didn't really spend much time with them because you didn't let them talk. So my tip today is have that internal agenda set up, that you're going to introduce yourself, and then you're going to move forward and find out some things about that patient that's going to help your treatment plan or help with moving forward with that patient. Stay tuned for more. Thanks so much.